Achilles drill when nailing success gets simplified. Welcome to my lecture today, where I will take you on some common head and neck steeplechase questions. In the course of this lecture, of course, we'll talk about the bones of the head and neck, the histology of it. We'll talk about some muscles associated with this region. We'll talk about the innervations to those muscles, and we'll also mention some things as regards the embryology of this region, the head and neck. Okay, and it's going to be a lovely session, and you have to wait to the end. Okay, so let's take a look at the first model we've got here. Okay, now this is the calvaria of the skull. We're looking at the skull from on top in this picture, and you can see some structures are painted here already. The first of which is the one in blue. Okay, the region in blue right here, which I'm kind of labeling red now, that region is a common point for steeplechase questions. And as a matter of fact, you can also see this region right here in red, which I will label blue. Okay, that's another point on the calvaria of the skull. Okay, now these regions are quite direct. The one in blue is basically the sagittal suture, while the points in red, I will draw your attention to it, but I want you to take a look at this line right here. Okay, that line dividing the frontal part of the skull from the parietal part. Okay, so that is the coronal suture. Okay, I have a better picture for that. Now take a look at this. All right, we established that the one in the midline is the sagittal suture, the one crossing it right here is the coronal suture, and right here there is a point. Okay, there is this meeting point of the coronal and sagittal suture called the bregma. The bregma is an important craniometric point. We also have one here behind, which is called the lambda. The lambda is basically the meeting point of the lambdoid suture. The lambdoid suture meeting with the sagittal suture in the midline. Okay, sagittal suture is running here in the midline, and then lambda suture is crossing horizontally. Okay, so that craniometric point right there is called the lambda. Okay, and these are important points for steeplechase questions. They're quite simple and very easy to recognize, and once you just know these basic three structures on the calvaria of the skull, you're good to go. The coronal suture, sagittal suture, lambdoid suture, and then the lambda itself, that craniometric point. Okay, so let's come up here. Can you guess what region is painted here? Okay, what's that point? Yeah, of course, that's the bregma, the meeting point of the sagittal suture and coronal suture. Let's move on to the next to our next models. Okay, still the same thing here. All right, now this is a fetus skull, the skull of a fetus. Now in a fetus skull there is a prominent suture in which you wouldn't find in an adult skull, but it's right there on the fetus skull. This suture is called what? Can you guess? Of course, that's the frontal suture, otherwise called the metopic suture. Okay, and it's also important. Sometimes the question won't be what it is. The question might be what is the ID time for the closure of this suture, which is basically age 6. By the sixth year of life, the metopic suture should have closed up. Okay, although it might persist in some people, but ideally it should close up by age 6. Okay, now this is another model. Can you take a look at this? Well, it's not too clear here. Let's take a look. This is also a fetus skull. Now can you tell me what region is in red here? This diamond shaped region. Yeah, that's the anterior fontanelle of the fetus skull, and right here we're looking at the fetus skull from the side. Okay, I have a better picture for this, and right here we're looking at the fetus skull from behind. As a matter of fact, that is the posterior fontanelle right here. Okay, posterior fontanelle is what we're having here. I have a textbook picture showing all this properly. Yeah, so the one you have in the front is the anterior fontanelle. Okay, the one labeled red earlier, and the one on the side here is the sphenoid fontanelle, and we even have one right here posteriorly called the posterior fontanelle, and there is also a mastoid fontanelle right here. Okay, so these fontanelles, you find them on the fetus skull, and of course this picture right here is a picture from on top. We're looking at the skull from on top right there. Okay, so when does the anterior fontanelle close? Because sometimes the question might not be what fontanelle it is. It could be when does it close. So the anterior fontanelle basically close between the 18th to 24th month. Yeah, that's the anterior fontanelle. For the posterior fontanelle basically closes within the first to the first or the second month. It closes between the first 2 months of life. Okay, that's for the posterior fontanelle. This sphenoid fontanelle takes about 6 months and all, but just understand that the posterior fontanelle will be the first to close, followed by the sphenoid fontanelle, and anterior fontanelle, as a matter of fact, is the last to close. Okay, it persists really long. Even as at age 2, you will still be seeing the anterior fontanelle. Okay, so now let's move on and talk about some other models. We've established this the metopic suture, otherwise called the frontal suture, and it closes when? Can you remind me? The 6th year of life. Okay, that's that about that. So here is a beautiful picture, and what I just want to do now, I want you to understand that I'm going to make a session through this region of the skull, and then I'm going to turn this part upside down. Okay, so I'm going to turn it upside down, and then we'll make reference to some important structures there. Yeah, we have the picture here. Okay, now this is the cap of the skull. Yeah, the calvaria, and inside it a number of structures can be painted. Okay, the first of which I'll draw your attention to is this one in the midline. Okay, this region right here is in the midline, and you'll be asked to identify what it is, or you'll be asked to identify a structure related to that part. Okay, and I also want you to take a look of this tree-like structure shaped like the branches of a tree, and then there are these prominent hollow structures within this cap of the skull. So they have names. Okay, and I will show you a textbook picture showing those. Okay, for the one in the midline, let me get a red pen. The one in the midline is basically the groove for the sagittal for the superior sagittal sinus. Okay, that's that region right here. The name is the groove for the superior sagittal sinus, and if the question is what's related to the part, simply the superior sagittal sinus. And take a look at these ones. Let me get a green pen. This foramen right here, these little O's lateral to the groove for the superior sagittal sinus, those foramen are basically called the granular foveolae. Okay, and they are associated with the arachnoid granulations, projections from the arachnoid matter, the arachnoid granulations. So they're the ones giving rise to those foramen right there. And lastly, the tree-like structures. Let me get yellow. All these branches are basically, they are associated with the middle meningeal artery. Okay, and they are I will show you a better picture of this. So the name is grooves for the branches of middle meningeal artery, and if the question is what was related to this part, is basically the branches of the middle meningeal artery. Take a look at this. You can see the various branches of the middle meningeal artery. It enters into the skull through the foramen spinosum, and then it forms numerous branches on the calvaria, the interior part of the calvaria. Okay, now apart from that, another structure associated with the one in the midline is the vas cerebri. Okay, the vas cerebri is also running somewhere along the midline of the skull, but of course very much prominent is this superior sagittal sinus. Okay, so that's that about that. Can we move on to our next models now? Yeah, take a look at this picture. Not so clear, but then I just want to draw your attention to the part painted green and also the part painted red right here. You could be asked to identify these bones, and they're direct. Okay, so the same picture is here, and take a look at this point right here too, the roof of the orbit. Okay, you can see it's marked X, and you just be asked to identify the bone forming that region. Okay, we'll solve those questions now. Okay, take a look at this question right here too. The lateral part of the orbit is painted. In the earlier picture we have the superior part, the roof of it painted. But right here we're having the lateral part. So you can just be asked to identify the bones forming these regions, and this picture answers it all. Okay, starting with the one that was painted green earlier. That's basically the zygomatic bone. Okay, can we go back to that slide? Yeah, the region in green right here is the zygomatic bone, and the region in red right here is the NASA bone. Going back to our textbook picture. Okay, can you see it right there? That's obviously the NASA bone. Now in the region associated with the roof of the orbit, can you answer it? Yes, the frontal bone is associated with the frontal bone. Okay, while the part associated with the lateral part of the orbit, okay, the one that was kind of labeled pink earlier. So the lateral part of the orbit is associated with the zygomatic bone. Okay, so and that's that about that. As basic as these questions seem to be, they are they're quite common. You find them being asked in practical exams. Okay, so and right here I want to draw your attention to this. Can you just come here, come into this foramen just on top of the orbit? Do you know what foramen that is? Well, that is the supraorbital foramen. Okay, in some textbook you see it as the supraorbital notch. They are not too different from each other, just that in the case of a notch is not a complete foramen. Okay, so there is a better picture here. The supraorbital foramen, which is right here, and it is associated with the supraorbital vessels. The supraorbital vessels, like the supraorbital vein, and even the supraorbital nerves. Okay, they pass through that that foramen. Okay, can we go back to our slide? So that's the region associated with A, pinned A here, and pinned B here. Okay, let's not forget there is also an important infraorbital foramen too right here. It's not too defined in this picture, but our textbook picture will show it properly. Infraorbital foramen, okay, somewhere here. Okay, let me get a better picture down here. And yes, we have the infraorbital foramen, supraorbital above the orbit, infraorbital beneath the orbit. Okay, so and there is also a zygomaticofacial foramen right here on the lateral part of the orbit. Okay, the zygomaticofacial foramen is associated with the zygomaticofacial nerve. Okay, so and the infraorbital foramen is associated with the infraorbital nerves and vessels. All right, so can we now answer other questions we've got here? Okay, now this is a soft tissue cadaver, and we are seeing a region being pinned right here around the orbit. Do you know what muscle that is? Well, that is the orbicularis oculi, the muscles of the eyes. Just that you could now be asked to be specific. If the region very close to the eyeball is pinned, then that's the palpebral part of the orbicularis oculi. But if it is this external part, that is the one kind of running around the margin of the orbit, those ones are the orbital part of the orbicularis oculi. Okay, so those are muscles that are often pinned in steeplechase around the orbit. Okay, so let's move on to our next model. And still on this picture, now what I want to do is, of course, I'm cutting through this call, but I want to look into the remaining parts. Okay, I want to look into the base of the cranium. Okay, so and there are some important structures associated with that region. Okay, starting with the first picture we've got here, and from this picture you can see there is a light being directed at this region of the skull. But we're coming to that, just take note of it. And we even have another picture down here. Wait a second. Okay, right here we have this part being painted. Okay, that's actually the lesser wing of the sphenoid bone. We're coming to it, and right here, can you take a look at this point in pink? This is a plastic skull though, but that region, take note of it. Earlier we have this point being painted, which is the lesser wing of the sphenoid, and then we have this region right here in pink. Okay, so take note of those, and here this textbook picture answers those. So the first one is the lesser wing of the sphenoid. Okay, and then we have the region right here called the arcuate eminence. Okay, the arcuate eminence. Now these regions are associated with the insertion point for the for a number of structures. For example, the earlier region called the lesser wing of the sphenoid is basically the demarcation point of the anterior cranial fossa from the middle cranial fossa right here. It separates, it's the boundary for those regions. Why the one behind here called the arcuate eminence? Okay, the arcuate eminence is a very important insertion point for the tentorium cerebelli. Okay, the dura infoding separating the cerebrum from the cerebellum beneath. Okay, so yeah, this picture shows the tentorium cerebelli inserting on the arcuate eminence, and it's also associated with one important sinus right there called the superior petrosa sinus. Okay, so it's also running along the edges of the arcuate eminence. Okay, take a look at this picture, still showing it, arcuate eminence inserting just along, the tentorium cerebelli inserted along the edges of the arcuate eminence. Okay, so what else are we leaving out? Okay, so we'll now talk about these various cranial fossa one by one, starting with the anterior cranial fossa, the medial cranial fossa, as well as the posterior cranial fossa. You can see on this plastic picture a number of regions have been painted. Okay, kind of messy, but then I'll walk you step by step and you will understand everything right here. Starting with this region in the anterior cranial fossa. Okay, well, let's just do a macroscopic thing, something quite gross. If I'm to ask you what part of the brain occupies this region, quite simple, right? Basically the frontal lobe. And then you come down here, and then probably in your exam there is a cotton wool inserted in this fossa, and then you are asked to identify what is associated with this region. Okay, that's basically the temporal fossa, right? The medial cranial fossa, we have a bulk of the temporal lobe, the temporal lobe of the brain associated with the temporal fossa. Okay, the medial cranial fossa. And right here behind, this is the posterior cranial fossa. And can you tell me what is associated with this region? We have the cerebellum there, we have the occipital lobe of the cerebrum there, and all. Okay, so those are quite large structures in those various fossa. Okay, now starting with the anterior cranial fossa, there is a white structure right here, a projection, an upward projection called the crista galli. Okay, I'll still show you a textbook picture of it. And then lateral to this crista galli, there is a sieve, like something like a sieve. Okay, just lateral to this crista galli, and that's where the occipital, the olfactory nerves pass through. The olfactory nerve coming from the nasal cavity, they pass through this cribriform plate. The region is called the cribriform plate. Okay, and the olfactory nerves pass through it. Okay, the one in yellow is what? The crista galli, and the region lateral to it is the cribriform plate. Let me show you a textbook picture of it. Okay, can we come down here and take a look at the crista galli, the upward projection right here, and then lateral to it is the cribriform plate, which has numerous olfactory foramina. Okay, various olfactory foramen in which the olfactory nerves pass through. Okay, so that's about that. That's one important thing I just want you to take note of in the anterior cranial fossa. So can we come to the posterior cranial fossa? And the posterior cranial fossa, there is this very prominent median fossa called the sella turcica. Okay, the sella turcica houses the pituitary gland, sometimes even regarded as the hypophyseal fossa. Okay, so yeah, I would prefer to just call it the hypophyseal fossa of the sella turcica, because it answers two questions. Sometimes you might not be too sure of, are they being specific on the hypophyseal fossa or just a part of the sella turcica. So that's why there is just labeled hypophyseal fossa of sella turcica, because it answers both questions. Either you mean the hypophyseal fossa or the sella turcica in general. Okay, so and that region is of course associated with the pituitary gland. Okay, so and another thing I want to draw your attention to are some projections around the hypophyseal fossa. Can you take a look at this projection? This one is called the anterior clinoid process, and then this one behind are the posterior clinoid process. Now those regions too can be painted, but basically they are associated with the tentorium cerebelli. The tentorium cerebelli insert on it. Can we come down here? Can you see the tentorium cerebelli inserting on the clinoid processes right there? Okay, so that's something associated with the clinoid processes. And then I also want to draw your attention to some foramens just lateral to the sella turcica. They are quite important. Okay, can you come back to this plastic picture? You can see a number of foramen have been kind of painted and is made messy right here. But okay, I will draw your attention. I will take it step by step. All right, there is one that is quite underneath this region right here called the foramen rotundum. We have it there, and then there is a very important foramen ovale which you wouldn't escape. It's quite large and it's associated with a number of structures. And then there is the foramen spinosum right there. Okay, and then most medial, let me use pink, most media is this foramen lacerum. The foramen lacerum is the most media, and in a real skull usually that place is occluded. Okay, it's occluded, but in a dry skull you still see the foramen still persisting there. Okay, but I want you to take note at the one in red, the foramen rotundum, and then the one in green, foramen ovale, and then the one in yellow called the foramen spinosum. Now let's go to our textbook picture. Okay, so come down here and you see those foramen again. The foramen rotundum is basically associated with the maxillary nerve. That's a branch of trigeminal nerve, of course. The foramen ovale associated with the mandibular nerve, the third branch of the trigeminal nerve, and then foramen spinosum associated with the middle meningeal artery. Okay, foramen lacerum is occluded, but let me show you a picture here. I have a picture showing the various contents of this foramen. Okay, we've established that the cribriform plate is associated with the olfactory nerve. We've not talked about the optic canal, but we'll get there. And then the superior orbital fissure as well. We're leaving these two out for now. And then the foramen rotundum associated with maxillary nerve. We have it right here. Let me get red. Foramen ovale associated with the mandibular nerve and some other structure, ovale. Okay, there is a mnemonic for it, ovale. Okay, the O is standing for optic ganglion, the E is standing for the third branch of the trigeminal nerve. Trigeminal nerve is V, of course, the fifth cranial nerve. So the third branch of it, which is mandibular branch of trigeminal nerve. O stands for optic ganglion, A stands for accessory meningeal artery, L stands for lesser petrosal nerve, and then E stands for the emissary veins. Okay, emissary veins also pass through those through that foramen. Okay, the foramen ovale. And then let's go down here and talk about the foramen spinosum associated with the middle meningeal artery. It's not labeled here. Okay, so that's that about that. Are we leaving out anything on these? So I will just try to move straight and let me not leave this out. I would like to emphasize on the optic canal as well as the superior orbital feature. Okay, well, we'll see it better from here. If you are looking into the orbit, okay, you can have a needle or a pin inserted into this foramen. You have to understand the most media is the optic canal, while the lateral one is the superior orbital feature. Let me use green. The one that is quite lateral in a way is the superior orbital feature. Now they have number of structures passing through them. The optic canal has the optic nerve as well as the ophthalmic artery passing through it, but the superior orbital feature has a lot of nerves. Talk about the trochlear nerve, the oculomotor nerve, the obducens nerve, and all. I think this established those. So oculomotor nerve, the motor innervation to the extrinsic muscles of the eyes, trochlear nerve, ophthalmic nerve, okay, a branch of trigeminal nerve, the first branch, and then obducens nerve. They all pass through the superior orbital feature. While optic canal was associated with it, remind me, the optic nerve itself, and then the ophthalmic artery. All right, so that's that about that. Let's take a look. Are we leaving out anything? Okay, so just a quick summary. Let me do this quick summary. We started with the anterior cranial fossa, which is associated with the frontal lobe of the cerebrum, and then we move on to these median structures. We started with the crista galli right there, and then lateral to it are a number of olfactory foramina, which are embedded within the cribriform plate. The structure says is the cribriform plate, okay, and it is related with the olfactory nerves. All right, so and then we came down to the middle cranial fossa. We talked about the foramen rotundum, foramen ovale, foramen spinosum, which are associated with the maxillary nerve, mandibular nerve, and middle meningeal artery respectively. And then foramen lacerum is the most media and it's quite large. Okay, can we now move on and talk about other things associated with the head and neck? Okay, so we'll be coming to the posterior cranial fossa now. The posterior cranial fossa, there is this prominent structure you will see first, okay, and that is the foramen magnum, quite large. Okay, the foramen magnum is basically associated with the spinal cord. The spinal cord, which is a continuation of the medulla, passes through the foramen magnum. Okay, while we also have some structures here in this posterior cranial fossa. Can you take a look at this? this region right here is the cerebellar fossa. Okay, the cerebellar fossa is occupied by the cerebellum. Okay, the cerebellum occupies this region called the cerebellar fossa. Okay, and it is separated by this median crest right here. Okay, we'll still talk about those crests. We'll even talk about the confluence, the region associated with the confluence of sinuses here, this region associated with the transverse sinus and all. Okay, so but I want to draw your attention to this first before I move on to those the groove for the sinuses and all. Now I want you to come here on the medial part of the aqueous eminence. It is associated with the internal auditory meatus or internal acoustic meatus, which is where the vestibulocochlear nerve passes. Okay, the internal auditory meatus. And then we have this very large foramen in the posterior part called the jugular foramen, which is actually where the jugular vein passes through. The jugular vein is a continuation of the sigmoid sinus. Okay, if you trace that foramen, you will see it corresponding with the sigmoid sinus. All right, so that foramen too can be pinned in steeplechase. You just have a probe inserted there, and you have to identify what's associated with the region, basically the jugular foramen. Okay, so that's that about that. All right, so I can now move on and talk about these grooves right here. Okay, let me get a green pen. Now this region right here can be pinned in steeplechase. The region is basically the internal occipital protuberance. Okay, the internal occipital protuberance, and it is associated with the confluence of sinuses. Okay, take a look at this picture. All right, this region right here is the confluence of sinus, where the superior sagittal sinus is meeting with the straight sinus, and then the transverse sinus are moving laterally away from it. There's even the occipital sinus projecting downward. So that confluence of sinus is associated with the internal occipital protuberance. You must have watched movies where people get gunshots to the back of their head, and then the blood spill is always messy, and sometimes you even notice the blood is dark. It's not the normal scarlet red that we'll see. Okay, it's dark because the blood there are deoxygenated blood, venous blood. Okay, so and that region is very vascularized. All right, a gunshot to the point will cause profuse bleeding, which eventually result in death. Okay, that's why you see people fall down in movies, and then the blood coming from the back of their head is usually dark. That's because there is a damage to the internal occipital protuberance, which is causing leaking from this confluence of sinuses. Okay, now let's go back to that picture. We've established this is the internal occipital protuberance, right? And then moving laterally away from it is a groove, the groove for the transverse sinus. And then farther away from this groove, there is still another groove again called the groove for the sigmoid sinus. Okay, from confluence of sinus to transverse sinus, and then the sigmoid sinus. Okay, take a look at this picture. Same thing is established. Confluence of sinuses, transverse sinus, and then the sigmoid sinus, which continues as what? We've mentioned it today, the jugular vein. It continues into the jugular foramen, right? So that's that about that. Okay, now I want to mention something. This median crest right here can be pinned in steeplechase as well, and basically it's associated with the cerebelli. Okay, the falx cerebelli. All right, now the crista galli, I didn't mention it earlier. The crista galli is an important insertion point for the falx cerebri. The falx cerebri is the one dividing the hemisphere of the cerebrum, but the falx cerebelli, which is inserting here, divides the cerebellar hemispheres. All right, and that's that about that. Let's move on to our next models. Well, this picture is showing the falx cerebri here, and then the falx cerebelli down here. Okay, and of course there's the internal occipital protuberance associated with the confluence of sinuses. Okay, see the pituitary gland inside the sella turcica. Okay, and that's that about that. All right, this picture is not too clear, but I just want to bring your attention to this region right here. We're looking at the underneath of the skull now. We're looking at the entire skull from the inferior part of it. Okay, so what is pinned here is actually the palatine bone. Okay, And right here we also have some structures painted right here. These are the occipital condyles, of course. Now the occipital condyles are associated with the first cervical vertebra, the atlas. Okay, so they are associated with the atlas, and then the atlanto-occipital membrane as well, a very important thickened ligament joining the occipital condyles um, to the first cervical vertebra, atlanto-occipital membrane. Okay, so but I want to draw your attention to this first, the palatine bone. Now this picture is not too clear. Let me get you a better picture. Well, this is a textbook picture. All right, starting with the first bone. That bone can be painted. It is the palatine bone, the horizontal plate of the palatine bone. Why this other region right here, the remaining part of the hard palate, is formed by the maxilla itself, the maxilla proper. It's just this minor point that is formed by the palatine bone. Just this region right here, formed by the palatine bone. Okay, so there are still some structures I want to draw your attention to on this inferior part of the skull. We'll take them one by one. You can see a number of structures have been painted rather. The incisive fossa here, okay, the palatine suture here, and the posterior nasal aperture here, and a number of structures. We'll take them gradually one by one. Let's start with this region. Okay, now this region right here, painted blue, of course. Now that region can be pinned in steeplechase. You just be asked to identify what it is. Well, that's the incisive fossa, and another question could be what is related to that part. And that the structures passing to the incisive fossa are basically the nasopalatine vessels. Okay, I have a better picture here. The incisive fossa, otherwise called the incisive canal, and the nasopalatine vessels traversing from the nasal cavity and then moving towards the palate. Okay, so the nasopalatine vessels, they pass through this incisive fossa, and then on this hard palate region as well, we established that this is the median palatine suture, right? That region can be painted and you be able to identify it. And then right here is the palatine bone, of course. What do they say is forming this pinkish part, this pink part? Well, that is formed by the maxilla, okay, the maxilla proper. But then there are still some vessels on this palatine bone, the palatine bone proper. Okay, let me get ready. Yeah, this foramen right here, that foramen is the greater palatine foramen, while there are smaller ones right here called the lesser palatine foramen. They're basically associated with the greater palatine vessels, that is the artery and veins, and then the lesser palatine foramina is associated with the lesser palatine vessels as well. Okay, so that's that about that. Now there are still other structures right here. We'll take them gradually. We've established these, the palatine vessels. Now right here is the posterior nasal aperture, otherwise called the posterior choanae. Okay, so and then lateral to it are some important structures, the pterygoid plates. Okay, the pterygoid plates are lateral to this the posterior nasal aperture. The first one is the medial pterygoid plate, while we have a lateral one right here called the lateral pterygoid plates. Okay, and there are important insertion points or attachment points for muscles. We'll talk about them in details. Okay, so but just understand the one media is the medial pterygoid plate, while the one lateral is a lateral pterygoid plate, and in between them is a fossa called the pterygoid fossa. Okay, the region just painted pink here, that's the pterygoid fossa. All right, and it's also an important origin for muscles. Specifically the medial pterygoid muscle takes origin from there, while the lateral pterygoid muscle takes origin from the lateral part of the lateral pterygoid plate. Okay, so where we'll get there, but right here there are some foramen we've established earlier when we're looking at the base of the cranium, cranium. Yeah, so this is the foramen lacerum, and then lateral to it we have the foramen ovale. Is oval in shape, the foramen ovale right there. Okay, so and right here we have the carotid canal here, the carotid canal or carotid foramen, which where the interior carotid, the internal carotid artery passes through. And then posterior to it here is the jugular foramen, which the internal jugular vein exits from. And then right here we have the mastoid process, we have the styloid process here, where it's not too defined here. The styloid process is quite you will notice it in the lateral part of the skull. We'll get there. There's a better picture for it. Okay, looking at the skull from the side. Okay, here is the mastoid process and here is the styloid process in front, and in between them there is actually a stylomastoid foramen, just somewhere in between the stylomastoid foramen, which is the passage point for the facial nerve. The facial nerve passes through this stylomastoid foramen. Okay, the mastoid process is associated with the sternocleidomastoid muscle. Styloid process associated with a number of muscles: posterior belly of digastric muscle, stylohyoid muscle, okay, stylomandibular ligaments, and so on and so forth. Okay, so they are right there. But let's go back to our picture and then emphasize on other things we've not mentioned. All right, right here is the mandibular fossa. Okay, the mandibular fossa of the temple, where the condyle of the mandible articulates with to form the temporomandibular joint. Okay, yeah, it's right there. Okay, and of course, what foramen is this? Foramen magnum. Lateral to it are the occipital condyles. The occipital condyles. Now, on this occipital condyle, there is a foramen close to it as well. Okay, their foramen is the hypoglossal canal. It's not too defined here. I should have a better picture of it, a textbook picture at least. Yeah, we have the hypoglossal canal here. We are seeing it from inside, from the base of the skull. The hypoglossal canal is basically associated with the hypoglossal nerve. All right, so that's that about that. Okay, so what else are we leaving out? We've established that this is the the stylomastoid foramen in between the styloid process and mastoid process behind. Let me show you a textbook picture just to have a summary of what we've been saying so far. Well, this is the incisive foramen, the incisive fossa, and then the palatine bone, the greater palatine vessel and lesser palatine vessel. Then we'll move on to the posterior nasal aperture. We talked about the pterygoid plates as well. The pterygoid plates includes medial pterygoid plate, lateral pterygoid plate, and in between them lies what? The pterygoid fossa. The pterygoid fossa is associated with the medial pterygoid muscle. Okay, while the lateral part of the pterygoid plate, that is just lateral to the lateral pterygoid plate, just lateral to it, we have the lateral pterygoid muscle taking origin from there. Okay, so let's move on and talk about this region in the midline. This region is the vomer. Okay, the vomer is a bone contributing to the nasal septum. It contributes to part of the nasal septum. And of course, right here, the mastoid process and styloid process and all, and the jugular foramen as well as the carotid canal. Okay, so that's that about that. Let's move on to other structures associated with the head and neck. Okay, so we want to look at the skull from behind now, the posterior part of the skull. All right, the posterior surface of the skull, and the most prominent structure there is the occipital bone, of course. Now, on this occipital bone, I will draw your attention to the external occipital protuberance. We've talked about internal occipital protuberance earlier today, right? Okay, and that's associated with the confluence of sinuses. But the external occipital protuberance here can also be called the inion. It's a fanciful name for external occipital protuberance. Okay, so now a number of structures are articulating with that region too. The external occipital protuberance. We have the nuchal ligament and some important muscles inserting on it. Okay, so basically they are called the subrecti muscles. Okay, but before we get there, let me still tell you some other things associated with this posterior part. We have the inion here, right? And then there is a line here called the superior nuchal line. Okay, those lines too can be painted in steeplechase. And then we have the inferior nuchal line right here. Okay, inferior nuchal line, they are important attachment point for muscles, of course, and some of those muscles are here. Okay, the subrectal muscles. So we have the rectus capitis, and then we have the obliquus capitis. Okay, so those muscles are attaching to the external occipital protuberance and of course the nuchal lines. Okay, the nuchal lines. Okay, in addition to that, we have the nuchal ligament, which is very much associated with the inion, the external occipital protuberance. It's very much associated with it. The nuchal ligament, otherwise called ligamentum nuchae. Okay, so that's that about that, the posterior surface of the skull. And yeah, the superior nuchal line is also associated with the trapezius muscle, an attachment point for the trapezius muscle. I didn't mention that, so please take note of it. If you remember any of the subrectal muscle, you are good to go, and if you remember the trapezius muscle, you are also good to go. This picture shows that better. Can we come down here? Yeah, this is the trapezius muscle, and you can see it's articulating or attaching to the line, the superior nuchal line, somewhere right there. Okay, so that's that about that. Now we'll move on to the lateral part of the skull, taking a look at the skull from the side. Okay, now this picture is showing just that, and we've established that here is the mastoid process, right? And here is the styloid process, and now there are still some structures right here. We have the external auditory meatus there, the external auditory canal, we have it right there, and we have the zygomatic arch here, the zygomatic arch. Okay, so all these structures are important. We said the mastoid process is associated with the sternocleidomastoid muscle. Take a look at this muscle here. Yeah, here is the sternocleidomastoid muscle, which is very much important in the turning of the head. Okay, the styloid process is associated with the posterior belly of the digastric muscle. Talk about the stylohyoid muscle, the stylomandibular ligament, and all. They're associated with the styloid process. Okay, so and there is a fossa here. Well, let me get a better picture. Now, this fossa right here on the lateral part of the skull is called the temporal fossa, and it can be shaded in steeplechase. It can be shaded, and you just be asked to identify what is associated with it. The answer is direct, simply the temporalis muscle. And here is a picture of that muscle. The temporalis muscle is one of the muscles of mastication. It actively functions in closing the mandible. It inserts right here on the coronoid process of the mandible, and whenever it draws insertion towards origin, it closes the jaw. Okay, so that's the muscle right there. The muscle itself can be pinned to in steeplechase, basically the temporalis muscle. And the question could be, what's the innervation to the muscle? Can you remind me what's the innervation to temporalis muscle? Of course, the trigeminal nerve, the mandibular branch of the trigeminal nerve. Okay, so now there are also some lines right here. We have the inferior temporal line, superior temporal line, just around this temporal fossa. Okay, so they are right there, and they are also attachment point for this temporalis muscle. Okay, we've established here is the zygomatic arch, right? Zygomatic arch is right here, which is formed by the temporal process of zygomatic bone and the zygomatic process of temporal bone. Okay, so let's move on and talk about some other things we're leaving out. Well, this picture right here, not too clear, but understand by just looking at the skull from behind and under. So right here is the internal occipital protuberance, and then this line, the first line you will see is associated with the trapezius muscle, which is associated with the superior nuchal line. And then just continuing down the line, we have the origin from the origin of the sternocleidomastoid muscle. Here is the mastoid process, of course. So the sternocleidomastoid muscle is taking origin from there, and of course behind here is the origin for the trapezius muscle. Just from this picture, okay, the first thing you will see is from behind, coming from behind, we first see the trapezius, and then moving furtherly to the front, we then come to the origin of the sternocleidomastoid muscle. So those regions can be painted in the steeplechase as well, and that's that about that. So well, Well, let me get your orientation right. We are looking at the soft tissue now. Okay, here is the nasal region, the nose, and here is the upper lip, lower lip, and the associating teeth. Okay, now right here they are painting a structure just lateral to the cheek. Okay, the question will be was relating to this region. Okay, and the answer is, can you guess? Well, it's the stencil dot, okay, otherwise called the parotid dot. Okay, parotid gland is right here for producing saliva, of course, and then it gives rise to this duct called the stencil duct, which opens into the oral cavity. Okay, this is another picture of it, parotid gland, and then stencil dot, otherwise called parotid duct. It opens just around the first or the first and second molar. Okay, it opens just into the oral cavity around that region. Okay, so right here is above the where we are seeing the, let me get your orientation right. This is the orbit, this is zygomatic bone, and then this is the maxilla, of course. Okay, so the points painted blue, you know one muscle relating to that part, but let me show you a complete picture of it. Also, that same muscle too is also associated with the inferior part of the mandible. Okay, you know what muscle that is? It's a muscle of facial expression. Well, it's the buccinator muscle. Okay, the buccinator muscle has its origin from the outer aspect of the maxilla on top, just as we had earlier, and also the superior part of the mandible, the body of the mandible right there. So the buccinator muscle, it takes its origin from this region. Okay, so its attachment, it attaches to those various regions. So here are the pictures again, the point in blue, and then down here the point in green. It's associated with that muscle of facial expression, the muscle that allows you to blow. Okay, that's that about that. And on the mandible, a number of structures can be pinned or painted, and you will asked to identify the muscle relating to the point painted. Okay, we take them gradually, one by one. Okay, so and then we have a revision on it. Alright, starting with this, we are seeing the mandible right here. I would like to start with the condyle. This is a textbook picture, and here is a dry bone, of course. So let's take a look at this textbook picture. We'll still come down here to the point painted red. You understand the answer soon. So now I'll start with this and this. Okay, let me take the one that is articulating with the temporal bone first, which is the condyle of the mandible. This structure is simply the condyle of the mandible, while this one in front is the coronoid process. The condyle of the mandible is an important attachment point for the lateral pterygoid muscle. Please write that down. The lateral pterygoid muscle inserts on the condyle of the mandible. Okay, while the coronoid process here, the coronoid process is an important insertion point for the temporalis muscle. Okay, I will show you pictures of those, starting with the lateral pterygoid muscle. The lateral pterygoid muscle is the only muscle of mastication that opens the jaw. Okay, other muscles of mastication, they close the jaw, they pull it up. Okay, but this lateral pterygoid muscle, it opens it. Okay, and you can see it's inserting on the condyle of the mandible right there. So now let's talk about the coronoid process of the mandible. Okay, I have a picture of it here. Of course, here is the coronoid process of the mandible, and it is an important insertion point for the temporalis muscle, just as we explained earlier. Okay, here is the temporalis muscle, and you can see its insertion on the coronoid process of the mandible. But for the condyloid process, or the condyle of the mandible, what's attaching there? Simply the lateral pterygoid muscle, the green muscle right here. Okay, that's the lateral pterygoid muscle, and it is attaching to the condyle of the mandible. Okay, so now there are still some structures on this mandible that we'll make mention of now, starting with the ramus of the mandible. The ramus of the mandible too can be painted in steeplechase. Now it could be the interior point, the interior part of this ramus, or the exterior part, just as I'm painting here. There is the exterior part of the ramus. Sometimes the inside of the ramus too can be painted, and some muscles are attaching to it. Okay, all right, so starting with the interior part, the interior part of the ramus of the mandible. Of course, the ramus of the mandible, we have it cut here. There is a cut through it, but there's a muscle attaching to it there. The interior portion of the ramus of the mandible is associated with the medial pterygoid muscle. Okay, lateral pterygoid muscle, the one up here, is for the condyle of the mandible, but the one associated with the medial part of the ramus of the mandible is the medial pterygoid muscle, while the external part of the ramus of the mandible, that is the external part of it, is associated with the masseter muscle. Okay, the masseter. Right, so they are all muscles of mastication. They control opening and closing of the mandible. Okay, so and sometimes they can be pinned. The innervation to them is simply the trigeminal nerve, the mandibular branch of trigeminal nerve. Alright, just a quick summary now. The coronoid process, we said, is associated with the temporalis muscle, the condyle associated with the lateral pterygoid muscle, and then we move on to the ramus of the mandible. If the exterior part is painted, masseter muscle attaches to it, and if the interior part is painted, usually the angle of the mandible right here, if that region is painted, it is associated with the medial pterygoid muscle. Can we move on and talk about other structures within this mandible? Now, in this picture, we're looking at the interior part of the mandible. We're looking at the mandible from inside. Okay, and there is a projection up here, a bony projection called the lingula. Okay, the lingula is an attachment point for the sphenomandibular ligament. I will show you a picture of that. And just around this lingula, there is also a foramen called the mandibular foramen. Sometimes a needle is always inserted here, the mandibular foramen. Okay, so the mandibular foramen, the inferior alveolar nerve, it passes through the mandibular foramen. Okay, and just before going to a picture showing you that, I want to emphasize on this line. Okay, this line is called the mylohyoid line. Okay, the mylohyoid line, which is where the mylohyoid muscle attaches to. Okay, so there are a number of structures on the mandible, but I just want you to take note of everything. They are important areas for steeplechase questions. Okay, let me go over this again. Lingula right here, mandibular foramen right here, and the mylohyoid line right here. Okay, so let me show you now a picture showing you the attachment to this region. So the first one is the lingula. The lingula is an attachment point for the sphenomandibular ligament. So if the lingula is painted, they will just ask you what it is, lingula of course, or what's attaching to it, this sphenomandibular ligament. Okay, so right here you can see the inferior alveolar nerve. Let me get red. The inferior alveolar nerve, it passes into the mandibular foramen. Okay, the inferior alveolar nerve passes into the mandibular foramen right there, and then in fact it will enter, of course, and then it will come out via the mental foramen. There is also a foramen right here around the mental process. That foramen is called the mental foramen, and then it will emerge as the mental nerve. All right, initially the inferior alveolar nerve, then when it passes through the mandible, it will come out as the mental nerve. Okay, so that's that about that. And then we have the mylohyoid line here, which I explained earlier, is an attachment point for the mylohyoid muscle. The mylohyoid muscle. Okay, the muscles around the base of the tongue. Okay, so that's that about that. Okay, I hope I'm not on anything. Well, on the anterior surface of the mandible too, a number of structures can be painted. Usually the symphysis here, right here, the mandibular symphysis, or the mental tubercle. Okay, the mental tubercle right here, otherwise called the mental protuberance. Okay, the mental protuberance, and then on the midline we have the mandibular symphysis. Okay, so that's that about that. Let me draw your attention to some other things around the maxilla and mandible. Yeah, we already stated the vaccinator muscle takes origin from there. Now you can see the teeth is painted here, one tooth painted here, another painted here. Usually you'll be asked to identify what tooth is painted and you will be asked to be specific. Is it an incisors? Is it a molar tooth? Is it a premolar tooth? And even if it's a molar tooth, is it the first? Is it the second? Is it the third? That's why your knowledge of the dental formula is key. Okay, let's just run over it now. On each side, on each quadrant of the teeth, we have two incisors, two, and then we have one canine, just one. Okay, we have two premolars, and then we have three molars. Okay, so usually just count from in front. For example, now this is the first incisors, while this is the second incisors. Okay, all right, and of course we have just one canine, so there's no first, there's no second. Now this is the first premolar, this is the second premolar. Now right here we have the first molar, the second molar, and then the third molar. Usually they paint these this first and second. Okay, and they usually they confuse students sort of. They will just say this one right here, the one in red, is what. Now students are usually confused on which is first and which is the third. Usually we count from in front backward. Okay, so we count from the front backward. So this is the first and this is the third. First, second, third. Okay, so and that's what is painted just up here. So if I'm to ask you what's the tooth in red, yes, that's the first molar. And what's the one in green? The third molar tooth. Alright, so that's that about that. And this is another picture showing the dental formula. It's good to know it's 2/2, 1/1, 2/2, 3/3. Alright, and we've established that the buccinator muscle originates from there. Well, let's just do a quick revision. If I ask you what's attaching here, okay, the temporalis muscle. How about here? The lateral pterygoid muscle. Okay, how about this tubercle here? The lingular, associated with sphenomandibular ligament. Okay, what else? This is the mylohyoid line. The mylohyoid line is associated with the mylohyoid muscle. We've established this already. And then take a look at the interior part of the ramus. That angle right here, the angle of the mandible, is associated with what muscle? Remind me? The medial pterygoid muscle. How about the exterior part of it? The exterior part of the ramus of the mandible. For example, somewhere right here is painted the masseter muscle. Yeah. So that's that about that. And into this foramen, the mandibular foramen, associated with the inferior alveolar nerve. Okay, this is a coronoid process, of course, for temporalis muscle. So we'll take a look at the before I move on, what is this? The mental foramen. Yeah, the mental foramen, which is associated with the mental nerve, a continuation of the inferior alveolar nerve. All right. So now let's move on and talk about a sagittal section through the head. Let me just get your orientation right. This is the nasal cavity. The nasal cavity is right here. The oral cavity. There's a section through the person's through the cadaver's edge right here, such that we're made to see the medial structures. Here is the nasal cavity and all. Here is this hard palate and soft palate. So I'll walk you through some common steeplechase questions that could be asked in this region. Okay, so we'll take them gradually. I'll be using a textbook picture as well as a cadaver picture. Okay, so here is a textbook picture, here is a cadaver picture. All right, let's take them gradually. The first, which I would like to draw your attention to, is the external nose right here. The external nose, usually they will pin this region right here. This region right here is basically the septal cartilage, although well, it's not too defined here, but there should be a picture right here showing it. Okay, yeah, this is a cadaver picture, and you can see the septal cartilage here, which is separating the two nasal cavities. Okay, so septal cartilage is here, which could be pinned, often pinned, and then within the nasal cavity proper, we can have the concave pinned. Here is the superior concave, the middle concave, and then the inferior concave. All right, so now you could be asked to identify the meatus, the space in between each of these concave. All right here is the inferior meatus. To start with, this is the inferior meatus. Here is the middle meatus, and then here is the superior meatus. All right, so they're just the cavities between two successive concha. All right, So please take note of those. And just behind the cavity, the nasal cavity, is the nasopharynx. But within this nasopharynx, a structure can be pinned. I don't know if you are seeing this. This is the opening for the external, for the eustachian tube, the pharyngotympanic tube. That's the opening for it. Take a look at this textbook picture. Okay, we also have it right here. The opening for the auditory tube, eustachian tube, otherwise called pharyngotympanic tube. Okay, so we've established here the nasal concha and the metasis. Okay, the cavities between two successive conchae. All right, so let me go back to that picture, and I want to draw your attention to this. Here is the hard palate. Of course, the hard palate is somewhere here, but a continuation of it behind is the soft palate. The soft palate is what we have here, and the terminal point of it is the uvula. I'll still show you a textbook picture labeling all this. The uvula is just right here. Okay, and what is the name of the part of the pharynx behind here? The oropharynx. Usually a cotton wool will just be placed in that region, and you'll be asked to identify what it is, or a probe. That's the oropharynx. While behind here we have the nasopharynx. Okay, and we have this important cartilage here called the epiglottis. The epiglottis is right there, and it is basically forming the roof over the trachea. Whenever it closes, it covers the entrance into the trachea. Alright, so and what is the name of this muscle? You know what muscle this is? It's also an organ. Yeah, it's an organ in real sense, just made up of a number of muscles. That's the tongue. Yeah, that's the tongue, and the tongue can be pinned in steeplechase. The question will be, usually everyone knows is the tongue, so they often ask what's the innervation to it, the muscle innervation, the motor innervation to this structure. It is the hypoglossal nerve. The hypoglossal nerve innervates all the intrinsic and extrinsic muscles of the tongue except palatoglossus. Okay, so whenever this structure is pinned, the innervation to it is hypoglossal nerve. Okay, and what is the name of this cavity? This is the oral cavity, of course. And the sensory innervation to the tongue as well. Let's just run over it. Here is the anterior 2/3 of the tongue, and right here we have the posterior 1/3 of the tongue. Usually the sensory innervation, the general sensory innervation, the likes of touch, pain and all, is by lingual nerve. Lingual nerve is a branch of trigeminal nerve. That's for the anterior 2/3 of the tongue. Okay, while for the posterior 1/3 of the tongue, the general sensation is by glossopharyngeal nerve. Glossopharyngeal nerve is the ninth cranial nerve. Okay, ninth cranial nerve, glossopharyngeal nerve. Okay, and now the special sensation, the sensation of taste for the anterior 2/3 of the tongue, the special sensation is by chorda tympani, a branch of facial nerve. Okay, that's for the anterior 2/3 of the tongue, facial nerve, cranial nerve number 7. Okay, while for the posterior 1/3 of the tongue, posterior 1/3 of the tongue, the special sensation, that is sensation of taste, is by this same glossopharyngeal nerve. That's just that. So any question can be thrown at you around that. It could be what's the sensory innervation to this, general sensory innervation. It could be what's the special sensation, and you have to know if they are pinning the anterior 2/3 or the posterior 1/3. Okay, and they're quite simple. Okay, but the motor innervation is always by hypoglossal nerve. Hypoglossal nerve innervates both intrinsic and extrinsic muscle. Are we leaving out anything right here? Well, I doubt. Okay, let me just draw your attention to this. Here is the frontal sinus, and right here is the sphenoidal sinus or the sphenoid sinus. Okay, usually a radiograph too. You can have a radiograph showing this. Alright, I think I have models showing models of radiograph, and a number of such were pinned, and you just be asked to identify what they are. So that's that about that. So here's the textbook picture. You can just pause and run through it, and then compare with this picture, and then establish everything. Okay, so here are radiographs of the head, and usually they ask the frontal sinus is common, and here is the sphenoid sinus too somewhere here. Okay, and then there are some smaller ethmoidal sinus, ethmoidal air cells, and the largest of them all is the maxillary sinus, maxillary antrum, quite large. Okay, so these radiographs are important. You can just have a radiograph in your steeplechase exam and be asked to identify these parts. There is the zygomatic arch, of course. Okay, I think I have a better model here. Still frontal sinus, sphenoidal sinus here, mastoid air cells are right here, mastoid sinus, and the maxillary sinus, otherwise called the maxillary antrum, also right there. Okay, well, now let's talk about some bones of the neck, the the atlas and axis specifically. So if I'm asking you what bone is this, not too clear where, but then you can guess. This is the atlas, of course, and there is a textbook picture of the atlas. Now the atlas is the first cervical vertebra, okay, and it has a structure articulating directly with the occipital condyle of the occipital bone. Okay, so they are right there, and it has a very large cavity in front here in the midline. Okay, so now, well, sometimes you can have a probe right here, you can have a probe here. Now this region is occupied by the odontoid process, the dens of the axis, the second cervical vertebra. But right here is the spine, the neural canal proper. So you really need to identify this first cervical vertebra, the atlas, and you will note it by that large foramen in the midline. Okay, so and then there are still some important structures associated with it. Of course, here is the transverse foramen, okay, the foramen transversarium, and it is associated with the vertebral artery. You find it on all cervical vertebra. They have this transverse foramen, okay, on their transverse process. Okay, now let's move on and let me show you a picture of the second cervical vertebra. Here is the axis, okay, and it is noted by these important odontoid process, otherwise called the dens. Okay, let me show you a textbook picture of this. Now the dens is right here, which fills the anterior portion of the canal within the atlas. Okay, that dens, it occupies that region, and the embryological origin is basically the centrum of the first cervical vertebra, the centrum of the atlas. Okay, so and here is the neural canal, and it has a bifid spinous process. Actually, you find that in all cervical vertebra. All right, so and it also has the transverse foramen transversarium for the passageway of the vertebral artery, as well as the sympathetic plexus and all. Okay, so that's that about that. Is there anything we're missing out? Just note the dens. The dens is usually painted, the dens, the green structure, otherwise called the odontoid process, and the embryological origin is the centrum of the first cervical vertebra, and the bone itself, the entire bone, is the axis, cervical vertebra number 2. Alright, here are still pictures showing the various parts of a typical vertebra, the vertebral foramen, the transverse foramen, the foramen transversarium, the body of the vertebra proper, and all the bifid spinous process. Okay, right here you can see the transverse process. The transverse foramen is pinned, and you just be asked to identify what is passing through it. Simply the vertebral artery. All right, so let's just wrap up things with the external here. On the external here, a number of structures can be pinned. It looks simple, but you just have to know the various parts. I'll draw your attention to four region, or let me just say five region around the external here that can be pinned. You can take note of this for now. We'll come back to it. So here is a textbook picture showing the various parts of the external hair. The most exterior is the helix. Okay, the helix is right there, and just internal to the helix is what we have. There's the helix, okay, and just internal to it is what we have here as the anti-helix. Okay, the anti-helix is right there. All right, now I also want to draw your attention to this one. This structure right here can be pinned. This is basically the tragus of the external ear. Why the one just opposite is the antitragus, of the external ear. And then lastly, I told you I would draw your attention to 5 things, is the lobu of the external ear. Okay, where you attach your earrings and all. Okay, so those 5 regions are very common steeplechase questions. Okay, and let me include this region. Let me get a green marker. This region is the concha of the ear, very in close relation with the internal occipital, the auditory meatus, the external auditory meatus. Okay, So, and the concha actually has two parts, the cymba and cavum, but I just want you to take note of the fact that it's the concha. Okay, so that's that about that. So can we now come back here? So if I'm to ask you what is pinned here, what is pinned here, can you guess? Of course, the anti-helix. From this picture right here, you can see this is the anti-helix, and having been they pinned this region right here, okay, or they kind of pin the structure, what would be your answer? The concha, of course. And of course, if they pin this region, that would be your lobu right here, the tragus, and opposite it is the antitragus. So that's that about the some common steeplechase questions associated with the anatomy of the head. Okay, here is the textbook picture from Teach Me Anatomy showing the number, the various parts of the external hair, right? So, and that's that about that. Thank you very much for tuning into my channel. If you find the video helpful, do it to hit the like button, and there is a quiz. Okay, there's an online quiz just attached to this video. You can check the description box. You click on it and then it takes you to Telegram. Attempt the quiz. I'm sure you will find it really helpful. Okay, so, and that's that about that. Thank you.